For the measurement of the plantar fascia talar head correlation, you will need a dorsoplantar and lateral weight-bearing radiograph of the foot. The dorsoplantar radiograph should include the entire calcaneus, and the X-ray beam during acquisition should be 17 degrees posteriorly angulated towards the heel. First, the lateral view is inspected for a midfoot collapse due to a midfoot pathology that disturbs the integrity of the osseous structures of the midfoot. Osteoarthritis of the midfoot can cause a midfoot collapse that appears only in the sagittal plane, and the plantar fascia talar head correlation might not identify the flatfoot deformity. The complexity of this measurement is the result of the difficulty to locate the medial plantar fascia's calcaneal insertion on the dorsoplantar radiograph. Only the lateral radiograph shows the insertion of the plantar fascia. However, the medial wall of the calcaneus is a visible sclerotic line on the dorsoplantar radiograph and represents very well the medial lateral location of the plantar fascia's calcaneal insertion. The anterior-posterior location of the medial plantar fascia's calcaneal insertion on this sclerotic line is located with the help of radiographic landmarks that are visible on both the dorsoplantar and lateral radiograph. These radiographic landmarks are the anterior borders of the malleoli, the posterior border of the talus, and the sustentaculum tali. The proportions of the distances between the plantar fascia's calcaneal insertion and the corresponding landmarks on the lateral and dorsoplantar view are the same. To correctly measure these proportions, planes are drawn on the lateral and dorsoplantar radiograph that are parallel to the X-ray beams of these radiographs. This is how the measurement is done. On the lateral radiograph, the anterior borders of the malleoli are identified. A 17 degrees posteriorly towards the heel angulated line is drawn that touches the anterior border of the lateral malleolus. This line runs parallel to the X-ray beam of the dorsoplantar radiograph. If the foot was positioned correctly during the acquisition of the lateral radiograph, then the anterior borders of both malleoli are aligned. On the dorsoplantar radiograph, the anterior borders of the malleoli define the slope of the line running parallel to the X-ray beam of the lateral radiograph. A rotational malalignment of the foot during the acquisition of the lateral radiograph results in a discrepancy of the anterior border of the medial malleolus to the line drawn through the anterior border of the lateral malleolus. This discrepancy should be accounted for when drawing the slope of the line touching the anterior border of the lateral malleolus on the dorsoplantar radiograph. Once the line of the anterior border of the lateral malleolus is drawn, a second parallel line running through the posterior border of the talus is drawn on the lateral and on the dorsoplantar radiograph. A third line is drawn parallel to the previous lines running through the insertion of the plantar fascia on the lateral radiograph. A third line is drawn also on the dorsoplantar radiograph, reproducing the same proportions of the distances between the three corresponding lines on the lateral radiograph. The medial plantar fascia's calcaneal insertion is located at the intersection of the third line and the sclerotic line representing the medial wall of the calcaneus. A connecting line is drawn between the medial plantar fascia's calcaneal insertion and the medial border of the tibial sesamate. This line represents the medial border of the plantar fascia. For the short version, to assess for a flatfoot deformity in the daily clinic, the center of the talar head is estimated. Often the center of the talar head is clearly medially or laterally to the line of the medial border of the plantar fascia. The exact measurement of the shortest distance between the center of the talar head and the medial border of the plantar fascia differs from the short version only in the method to locate the center of the talar head. The center of the talar head is located using two chords which run from the most lateral to distal and distal to medial talar head circumference, articulating with the navicular. For each chord, the perpendicular bisectors are drawn using three equally sized circles. The center of the talar head is located where the two bisectors intersect. The shortest distance between the medial border of the plantar fascia and the center of the talar head, DPT, is measured. During surgery, the medial plantar fascia's calcaneal insertion is located with a K-wire. The K-wire is inserted about 2 centimeters superiorly to the insertion of the plantar fascia until the resistance of the medial wall of the calcaneus is felt. The proper location of the K-wire is verified on the lateral view first. Then the foot is pushed perpendicular onto the OR table, and the dorsoplantar view of the foot is acquired with the X-ray beam 17 degrees posteriorly angulated towards the heel. During surgery, a ruler can be used to connect on the screen the medial border of the tibial sesamate and the tip of the K-wire. The center of the talar head should, after correction, be clearly laterally located to the ruler. If not, the correction is not sufficient and additional procedures to correct the deformity should be considered.